Low back pain is extremely common. 80 to 90% of people have an episode of low back pain at some point in their lives, and this can occur as young as being a teenager, and it becomes a little bit more common as we get older. There's a lot of causes of low back pain, the most common being pain from the lumbar disc or pain from the joints of the spine. This is a model of the lumbar spine, and the parts that move are the lumbar discs, the rubbery structures between the bones. The facet joints are in the back of the spine. They're about the size of your knuckle joint. And the sacroiliac joint is a larger joint that joins the spine and the pelvis. Those are the three most common causes of low back pain. There are some concerning causes of low back pain, although they're fairly rare. One that we often think about is cancer causing low back pain. That's a very uncommon cause of low back pain. Another concerning cause is infection of the spine. This is extremely rare. This is less than 0.01% of causes of low back pain. Finally, a fracture is a concerning cause of low back pain. That can happen if there's a significant trauma, or if somebody has brittle bones or osteoporosis, then a fracture can occur even with minor trauma or minor activities. Sometimes our patients have pain that starts in the back and shoots down the leg, and oftentimes that means that there's a nerve being pinched in the back. This is a model of the lumbar spine, and you can see at every level of the spine, a pair of nerves leave the spine. Nerves are just like little electrical wires that leave the spine and travel down into the legs. And if those nerves are being pinched, you can have pain shooting down the legs or possibly numbness or weakness in the leg. Oftentimes, low back pain is going to improve over time. So if pain is mild and improving, someone really doesn't need to seek medical care. However, if pain is severe or it's not getting better over time, that's a time to see your primary care provider. Another reason to see your primary care provider is if there's weakness in the legs associated with low back pain. Occasionally, there may be a need for an emergency room visit. That's not common, but that would be the case if there's weakness in the legs that's severe, if there's pain so severe that you can't walk, or if there's acute changes in your bowel or bladder habits. For instance, if you're unable to urinate when you have a new onset of low back pain, that can indicate that the nerves are being severely compressed and damaged. So preventing low back pain is really targeting the risk factors for low back pain. Low back pain risk factors include being overweight, smoking, or not being in good shape. So losing weight, smoking cessation, and exercise can be helpful for preventing low back pain. We also think about someone's daily activities when we think about preventing low back pain. So if somebody has a very sedentary job with prolonged sitting, that can trigger low back pain. So standing frequently throughout the day or possibly using a sit-stand workstation can be helpful. In people who do a lot of heavy bending, lifting, and twisting, they're also more susceptible to injuring their back. So working on core strength so that they can protect their spine and using good lifting mechanics can help prevent low back pain.